It is my great pleasure to introduce our next speaker, Dr. David Lukoff. Dr. Lukoff has been a real groundbreaker, a true pioneer, raising awareness about spiritually transformative experiences and spiritual emergencies to healthcare professionals. As co-author of the American Psychiatric Association's DSM, which is the Diagnostic and Statistical Manual, the diagnostic category, religious or spiritual problem, which was a real breakthrough. Spiritual Awakenings International has recognized Dr. David Lukoff for his pioneering work as an honoree in the Spiritual Awakenings International Circle of Honor. So congratulations, Dr. David Lukoff. Dr. Lukoff, PhD, is a licensed psychologist, previously based in California and currently living in Germany part-time. Dr. Lukoff has published over 80 articles on spirituality and mental health. He is a professor emeritus of psychology at the Institute of Transpersonal Psychology in Palo Alto, California, and he previously served on the faculties of both Harvard and UCLA. David is the co-founder and co-leader of Spiritual Competency Academy. Please welcome David Lukoff.
Thank you, Yvonne. I'm excited about presenting today because the challenge of it led me to do some reflecting about the trajectory of my entire career. And the focus of my career right now is on this concept of spiritual competency, but it actually dates back to, first of all, that personal experience that triggered my interest in spiritual emergencies. And then it was that work on spiritual emergencies that led to the diagnostic and statistical category that Yvonne mentioned. And then after about 20 years of working in that niche, to this broader area of spiritual competency. And as a result of that reflection, I reorganized the presentation I have given at many grand rounds and other places on spiritual competency to include that whole process, because I think making it into a personal story might be of a little more general interest, as well as the fact that it served as a bit of a life review for me. So let me go ahead and share my screen and start the PowerPoint talk here. So as I mentioned, I want to start with this concept of spiritual emergency, including my own personal experience. And that will be largely using the perspectives and terminology from transpersonal psychology. And then I'll move to the whole area of the Diagnostic and Statistical Manual and the concept of religious or spiritual problem, that diagnostic category. And then I'll also talk about how that led to the broader concept of spiritual competency that is my current professional focus. So my personal experience began in 1971. It was kind of my 60s experience in that it was triggered by LSD. I had been a graduate student at Harvard in anthropology and went through what was really more of an existential crisis. I started to question why I was in graduate school. I was pretty young. I'd skipped a year in high school and gone right to college and then to graduate school. So I was not even 23 years old, and I got my master's degree in anthropology. And all of a sudden, I started to really question why I was doing this. Now, part of my background is that my father was a professor and my grandfather was a professor. And I've been raised also in a very secular environment no issues around religion or spirituality at all. And I just began to just question, why was I doing this? Who was I? Did I really want a career in academia and so on? And very precipitously, right after I got my master's degree, I dropped out of Harvard and began hitchhiking around the United States. And after about 6 months of hitchhiking in Colorado, actually up all the way up into Canada, and then down to Colorado, and then into Mexico for a while, I landed in San Francisco. And walking around Golden Gate Park, never been there and just was, a tourist walking around that area, somebody offered me a free tab of LSD. And I had never taken a psychedelic drug. I maybe smoked a couple of joints with people, but it was never a focus of mine. But I also decided that, I was on the road to find out. If some of you remember the Cat Stevens song, and I was purposely doing things that I had never done before. So I decided to go ahead and take the LSD. I didn't do it right away. I took it the next day, actually, which was a smart thing because I did it on an empty stomach. And then I went back to Golden Gate Park and I just started to walk around Golden Gate Park on the LSD. And, I had, I guess, kind of a classic LSD experience. I started to see the trees moving and breathing. And I walked up to a tree, which I'd never done anything like this in my life before, and I hugged it. It was just like I felt connected to this tree. And then I walked, if you know Golden Gate Park, it actually is on the Pacific Ocean. And so I walked over to the beach and I sat down on the beach and I just watched these waves rolling in and started to have thoughts like I've never had before, that the ocean was in me and I was in the ocean and I was the wave and the wave was in me. All kinds of really interesting thoughts, I thought. But, at the end of the day, I went back to this apartment I was crashing in and thought, well, that was an interesting experience, but it really didn't change my life or anything, So, maybe I'd do it again sometime, maybe not, no big deal. And then in the middle of the night, I just woke up to go to the bathroom. And as I was walking into the bathroom, I looked in the mirror and I started to hold my hand up in this position. Now I would call it a mudra. I'd never heard that term before. But immediately my hand started to give off white light. It started to glow. And immediately I knew what it meant. It meant that I was a reincarnation of Buddha. And then right away after that thought, I thought, oh my gosh, I'm also a reincarnation of Jesus Christ. And I must say, at this point in my life, I knew nothing about Buddha or Jesus Christ. I had never studied anything, never read the Bible, never meditated, and yet I was convinced I was a reincarnation of Buddha and Jesus Christ. And I had a new mission that Buddha had created a religion for the East, and Christ had created a religion for the West. Very simplistic thinking at that, I would say now. But it also meant that my new reincarnation, I was to write a new holy book, one that would unite all the people in the world, East, West, North, South, etc. Okay, so I immediately went to my backpack that I had been hitchhiking around with. I'd gotten rid of everything I owned that wouldn't fit into a backpack at that point. And started to write this new holy book. And for the next 5 days, I hardly slept. I hardly ate. I remember having a couple bags of peanuts and things like that. During that time, I had these conversations with people like Bob Dylan because I thought, oh, well, yeah, I was going to write a new holy book, but, I wanted to communicate with, a much larger audience as well. And I thought, oh, yeah, Bob Dylan knows how to do that. And Cat Stevens, people like them really knew how to reach the masses. And then to refine my thinking, I had these conversations in my mind, but I thought I was actually communicating with Sigmund Freud and Jung. And that's a picture of R.D. Laing on the left and Margaret Mead in the middle there. And I was my background, my master's degree was in anthropology. So I thought, oh, yeah, I should talk with Margaret Mead. She's an expert in cross-cultural understanding. So then after 5 days, I had my holy book. And I made about 40 copies. And then I had to figure out, how do I distribute it? And at that point, I concluded that Berkeley was the new Jerusalem. So if you look at this picture at the bottom, there's a picture of old Jerusalem. And then there's this kind of new age image above it. And that's, I thought, what was Berkeley was, this new age version of Jerusalem, from which, we know Judaism, Christianity, and Islam all came from. So this was a great setting for this new kind of religion that I was founding. So I went to Berkeley, and this was a bookstore in Berkeley at the time. Now it's a different kind of store, but I literally started in front of this store, and I started to hand out copies of my book. And as cars drove by, I would, if they were stopped at the stoplight, I walked out and I gave them a copy of my book, started distributing it. And my assumption was that, I would distribute it to these people and they would really like it. And then they would distribute it to other people and they would really like it. And then those people would distribute it to yet more people. And that's how my book would travel around the world. So after I gave away all copies of my book, and I did mail a few to friends and to my family, which later I realized freaked them out, but I mostly gave them away. And then I thought my job was kind of done. I just needed to wait for it to travel around the world, and then I would be recognized as kind of like a messiah of this new religion. Now, at that point, I had no money, no place to stay. And I again began hitchhiking back to places I had lived. I'd lived at Chicago for 4 years when I was an undergraduate at the University of Chicago. And then I stayed with friends there. And then I hitchhiked to the Boston area where I'd gone to graduate school, and I had friends there, and I stayed there. And for the next 2 months, my friends let me stay with them, fed me. As I said, I had no money. I wasn't paying for room and board at all. And I consider myself very lucky because I didn't end up in the streets. I didn't end up at a psychiatric hospital. I didn't end up on medication. I just kind of felt, I don't know if entitled is the right word, because I don't think I was particularly grandiose. I didn't actually talk about being a new Messiah. I just talked about interesting things. I actually did talk a lot about religion and its role, et cetera, but I didn't think I needed to talk to my friends about that I was going to be the new Messiah or anything. So they, took care of me during that time. And now since then, I've now learned about similar kinds of approaches uh, that have been tried with people who are having these kinds of acute psychotic disorders. There's places like Soteria House and Diabasis that have let people in my state of mind do what my friends did for me, that is, take care of me, feed me, have a safe place to eat, not put me on medication and so on, and just let me go through the whole experience, which I was able to do in about 2 months. In about that time, at the end of those 2 months, my feet were back on the ground. I kind of realized that people are not calling me to lead them in a new religion. What's going on here? And at that point, I started to try to figure out what this was all about. I didn't really fully understand it. I still thought something profound had happened, but I kind of got that I wasn't being recognized as the founder of a new religion. So I stumbled upon Jung's works, Joseph Campbell for the first time. And I started to find that they were actually talking about experiences that were sort of similar to my own. And then there's a book by a guy named Buck, Bucke, Richard Buck, called Cosmic Consciousness. And he talks about people who had experiences very similar to my own. He included Jesus Christ and Buddha, and he himself had an experience like that. So all of a sudden, I started to realize, wow, I think what I had was an interesting, profound experience, but I needed to learn more about it. So I hitchhiked to where my parents had a summer house in Massachusetts, Cape Cod, Massachusetts, and it was a house they only used in the summer, like July and August. And I hitchhiked there in March, when it was still pretty cold. And they gave me permission to do that. And they actually also, I asked if they would give me $40 a month to just buy some food. And then I spent a lot of the time at the library there reading other books like by Jung and Campbell and so on. Now, during that time, that I was learning all this, I was also starting to feel very embarrassed about my experience and, thinking I was a reincarnation of Buddha and Christ and so on. And I began to also question, dropping out of Harvard and what was I going to do with my life and so on. And I became, I don't know if I was clinically depressed, but, I was having a lot of trouble sleeping, and I had a lot of self-doubt and self-recrimination. And at night, when I was trying to go to sleep, I started to see these kinds of horrific figures hovering above me that made it difficult to sleep. And I even saw a skeleton hovering above me. And I took that to be my own my own skeleton. And I also had a recurrence of an illness that I had when I was like 13 called Crohn's disease, with some internal bleeding and a lot of cramping and pain. And I hitchhiked to a free clinic, and they gave me a bunch of pain medication. And I started at night when I couldn't sleep and I was still having a lot of pain. I was seriously considering taking all of this pain medication and ending my life. I was suicidal. And my thought was that would be a route to peace, that if I was dead, I wouldn't have all these doubts and insomnia and pain and so on. Now, during that time I was living in Cape Cod, they had these wonderful beaches. And I was in the habit during the daytime, like, noonish, when it was sunny a little bit, of going on a walk on the beach. Now we'd call that a wellness practice. So it was a good thing to be doing. And while I was walking on the beach, I all of a sudden heard a voice. And it actually was different from those voices I mentioned with Bob Dylan and so on, because it didn't feel like it was inside me. I turned around. I thought there was somebody behind me saying this, but there was absolutely nobody there. And what I heard was, and I only heard it one time, but it was very loud, very clear, and it said, "Become a healer." And I went, "Become a healer?" From my anthropology, I thought a healer was like a shaman, looked like that. And, what was I going to do? In 20th century America, there was no occupation of being a shaman, being a healer. But then I thought, oh, well, a contemporary version of that is being a doctor. Maybe this meant I should, go back to school and take some organic chemistry and then apply to medical school. But then I thought, well, there's alternative kinds of versions of that too. Like this is a store that was selling herbs. And then I thought, well, there's also these practices. I never done them, like yoga and Tai Chi and stuff. I thought maybe this was something about becoming an alternative healer. So I decided that I would find out more about alternative healing. And my parents at that point were very generous. I called them up and said, I want to learn more about these alternative healing. And they lived near New York City at the time. And I thought in New York City, I could study these things. There's a place that is still there to this day called the Open Center, where they teach these things. And my parents put me up at their house and paid for me to take courses in encounter groups, Gestalt and psychodrama. And I ended up really liking these alternative therapy things, especially the encounter groups and Gestalt and psychodrama. And I took a training program in that. And then for 3 years, I became a encounter group leader, including Gestalt and psychodrama and primal therapy and bioenergetics and all these things. And after doing that for 3 years, I thought, well, that's what becoming a healer is for me. And I decided to go back to graduate school and get a doctorate in psychology so that I could do this kind of work. Well, when I went to graduate school, I took my first course ever in psychopathology. And that's when I realized that what I had experienced would have been diagnosed in the Diagnostic and Statistical Manual 2 at the time. This was 1975 or so. I would have been diagnosed with acute schizophrenic episode. Now, at that point in my life, if you had asked me about it, I would have called it an episode of cosmic consciousness. But I realized, oh, wait a minute, if everyone in my profession thinks that this is an acute schizophrenic episode, maybe I shouldn't be talking about it. And that was actually pretty wise, because I think if people in my psychology department knew that I had taken LSD and that I had believed I was a reincarnation of Buddha and Christ for 2 months, they would have kicked me out of the program and said it was inappropriate for me to be in the role of being a psychologist. Now, for me, this was my spiritual awakening. That's how I also saw it, because all of a sudden I had gotten very interested in meditation. I took a meditation class for the first time, took a yoga class for the first time. I studied with people. This is a picture of Black Elk. He's the grandson of Black Elk Speaks. His name is actually Wallace Black Elk. So I started to study a lot of medicine work medicine wheel teachings, and so on. So it was my spiritual awakening too. Also, as a result of my reading, I realized that the kind of experience I had is similar to the experiences of shamans, especially when they're initiated, similar to the experience of yogis like Muktananda, the founders of religions, the saints and the desert fathers had experiences that overlapped with mine, and so did some of the famous mystics like Hildegard von Bingen and so on. And there's even some Western traditions, like Socrates said, our greatest blessings come to us by way of madness, provided the madness is given us by divine gift. And Rumi, this is one of my favorite little couplets of his, the mystic dances in the sun, hearing music others don't. Insanity, the others say. If so, it's a very gentle, nourishing sort. So I began to be aware, that there's this kind of overlap between madness and spirituality and so on that was not really very well recognized in the field, although there were a few people who had recognized this. Buck, I mentioned, called it cosmic consciousness. Stan and Christina Grof, although they hadn't written about it at this point, but they used that term spiritual emergencies. There's physicists who called it positive disintegration. Creative illness is a term. R.D. Laing called it metanoic voyages. John Perry, the Jungian analyst, called it visionary states. And later, I wrote an article in 1986 where I called it mystical experiences with psychotic features, because I thought there should actually be a diagnostic category for people who are having these kinds of experiences that overlap spirituality and madness. But another thing that I also learned in graduate school is that my profession, psychology, held a very negative view of religion. And that was true of all of the major founders of Western psychology. Freud wrote a book called Future of an Illusion, and he called religion a system of wishful illusions together with a disavowal of reality, such as we find nowhere else but in a state of blissful, hallucinatory confusion. And then Albert Ellis, who's one of the founders of cognitive behavioral therapy, said, spirit and soul is horseshit of the worst sort. Obviously, there are no fairies, no Santa Clauses, no spirits. What there is human goals and purposes, but a lot of transpersonalists are utter screwballs. And B.F. Skinner, the founder of the behavioral therapy model, called religion an explanatory fiction of a miracle working mind, and described rituals and prayer as superstitious behavior perpetuated by an intermittent reinforcement schedule. In other words, if you pray for a lot of things in your life, every once in a while, by random chance alone, something you pray for will happen. But it's totally by random occurrence, but it reinforces the prayer behavior. So that was his whole explanation of religion. Fortunately, I, at that point, was living in California and heard about Stan and Christina Grof. And I got involved in 1980 when they were just founding the Spiritual Emergency Network. And I was involved with them with the founding of that at Esalen. And then they wrote a book on it. And One of their points was taken from Joseph Campbell. To my amazement, Joseph Campbell wrote, the imagery of schizophrenic fantasy perfectly matches that of the mythological hero's journey. So that idea really intrigued me. And I was encountering some people in my clinical work who had experiences that were similar to my own. But, and I worked with one of them to do a very detailed examination of the mythic images in their psychotic experience. Now, later I did that with my own experience, but I was still afraid of sharing my own experience at that point in my career. So I wrote this article for the Journal of Transpersonal Psychology, looking at the mythic imagery in somebody else's experience. And then based on that, I made this proposal for a new diagnostic category called the diagnosis of mystical experiences with psychotic features, which shows that people who have experiences like my own are having valid mystical experiences, but they also have some psychotic features that have to be dealt with. Well, Francis Liu, whose picture is here, contacted me about that article. And then he and I began to work together in the Spiritual Emergency Network to try to actually go ahead and make or propose a diagnostic category for these kinds of experiences. And part of what we did was summarize some of the literature on spirituality that was just being published. And what this chart shows is that in psychiatric and psychology journals, there was a dramatic increase that was happening right around this time that we were making this proposal in the number of articles, research articles on religion and spirituality. We could point to this in our review, and that this new research was showing that religion and spirituality were actually playing a beneficial role in preventing mental and physical illness, in improving how people cope with mental and physical illness, and in facilitating recovery from mental and physical illness. And we could also show that the majority of people in the United States actually had very strong religious and spiritual beliefs. 89% of adult Americans report they pray to God. 95 to 99% claim a belief in God, and so on. And based on, and we were also able to show that surveys confirm that many people bring religious and spiritual issues into their therapy, into their treatment. 60% of psychologists said that clients often express their personal experiences in religious language, and 1 in 6 clients present issues which directly involve religion and spirituality. So based on that, we wrote a very comprehensive review of all this research literature that I just described, and we turned it into a proposal for the DSM task force for a new category that at the time we called psycho-religious and psycho-spiritual problems. And we spent a couple of years going back and forth with this committee and the research and so on about our proposed category. And ultimately, it was accepted into the DSM as religious or spiritual problems. So they chopped off the psycho part, but they left in religious or spiritual problem. And this was the definition that they changed a few words, but this is basically the the language that we use in our proposal. This category can be used when the focus of clinical attention is a religious or spiritual problem. Examples include distressing experiences that involve loss or questioning of faith, problems associated with conversion to a new faith, or questioning of other spiritual values, which may not necessarily be related to an organized church or religious institution. So just as an example, they do in the category, they do mention loss of faith and changes in faith. So, many people will come to therapy if they convert to a new religion, because it can be very disruptive in their personal life and in their family life. If their family is all Christian and they convert to Judaism, the family often there can be some conflict. Or if they're a very, they come from a Christian family and then they become very devout and they want to go to church every day and they want to pray, before every meal, and the family didn't used to do that. Intensification can also result in some conflicts. Loss or questioning faith, actually, I've done some lit reviews, and that's the most common religious issue that brings people into therapy. But also joining a new religious movement or joining a cult or coming out of a cult, those are also kinds of issues that psychotherapists encounter. And also developing a serious or life-threatening illness is something that can both lead people to question their faith, or it can lead to people actually increasing their belief. But anyway, the point is that it can actually change their religious and spiritual beliefs and lead them into therapy. And spiritual problems can include having an experience like a mystical experience just out of the blue when they are not a very religious person, to all of a sudden feel that God is talking to them or feeling connected to a higher power. A near-death experience that we've just heard a vivid description of can also lead people to, have conflicts that they can bring into therapy. Unusual experiences like psychic experiences or alien abduction experiences can also lead to internal conflict, questioning, and so on. So can practices like meditation, yoga. We know of Kundalini crises. But now that meditation is caught on, there have been several articles published about people who have experiences related to their mindfulness practice. They can have dissociative experiences, depression associated with intensive periods of meditation, and so on. Yoga, as I mentioned, can lead to crisis. There's a whole literature on Qigong and crises. In fact, it's in the Chinese medicine diagnostic and statistical manual. There's a category called Qigong crisis, much more common in China than in the United States, but actually there are case studies of people in the United States who have that. And then possession. There's a whole literature on people who have possession experiences who are immigrants, people coming from Africa, South America, Latin America, where possession is an experience that's acknowledged in the culture. But then if they have it in Chicago, people can think that they're having a psychotic episode instead of a culturally valid episode. Okay, so those are examples of religious and spiritual problems. So as a result of being one of the people who proposed this category, I started to get a lot of invitations to give grand rounds at UCLA, UCSF, UC San Diego, many other hospitals, Kaiser Permanente. And I also got asked to give workshops on this topic of religious and spiritual problems. But I also started, as a person I'd worked at several hospitals, Camarillo Hospital, UCLA Neuropsychiatric Institute. I spent 14 years as a psychologist at the San Francisco VA Medical Center. And I also knew that, yes, people bring in religious and spiritual problems to talk about in therapy, but that for many of them, religion and spirituality wasn't a problem, it was a strength. It was a resource in their life. And then in 1999, the Joint Commission on the Accreditation of Healthcare Organizations started to require that there be a spiritual assessment in every patient's medical record, in their charts, that describes patients' religious preference, beliefs, and any spiritual practices. So as a result of this, when I was invited to give a workshop or even a grand rounds, I didn't want to just talk about religious and spiritual problems. I also wanted to incorporate their religious and spiritual strengths, and felt that that is often an important part of therapy as well. People may bring in a religious conflict, but at the same time, it can be a source of strength. Maybe they're having a conflict with their clergy member, so they're having a religious conflict. The conflict could be over the fact that they've started a meditation practice and their priest or their minister thinks, oh no, that's some Asian religious thing. You should not be doing meditation. You should be reading the Bible and praying. So there's all these kinds of potential conflicts in this domain, but there's also, for a lot of people, a lot of religious and spiritual strengths that if I'm functioning as a client's psychotherapist, that I need to be aware of and understand. And yet none of my training would have prepared me to talk to a client about their religious and spiritual problems or their strengths. So then that led me to this broader concept that I'm going to talk about now of spiritual competency, because I felt like a competent therapist should be able to talk to a client about their religious and spiritual problems, but also about their religious and spiritual strengths. And most people, certainly when I started this work 20 some years ago, would have been given the advice I was given when I was in my graduate school, which was literally, if I was told, if a client wants to talk about religion or spirituality, I should not engage in discussion with them. My role would then be to refer them to a religious professional, that I was not competent to talk to them about religion or spirituality. And in a way, that was a self-fulfilling prophecy, because my graduate school, like all graduate schools, I would say, back when I was training in the 1970s, would have had that position, and certainly would not have prepared their trainees in religious and spiritual issues, background, conflicts, or strengths. So the first thing I wanted to get across in my training on spiritual competency was that spirituality and healthcare have been connected since the beginning of human culture. This is a picture of a Navajo healing ceremony, and I'm using it to really kind of illustrate what shamanic healing was like. There would be a shaman or shamaness in some cultures who would work with the client in a community cultural setting. So the connection between healthcare and spirituality goes back to the very beginning of human culture. If you go back to ancient Greek culture, their temples, this is a picture of Asclepius, and the temple of Asclepius was where people who were sick went to be healed. And then the very first hospitals were all part of religious institutions. And that was true in the West, but it was also true in Asia. The very first hospitals were opened up by Buddhist temples. So in addition to just talking about it, I also conducted some surveys of consumers, of mental health clients. This was in California, where we did a survey of over 2,500 patients who were receiving mental health services, and 82% of them said that spirituality was important to their mental health, and that 74% wanted their mental health care providers to discuss spiritual concerns with them. So, together with some colleagues, we realized that the field of psychology and mental health, psychiatry, social work, we're all starting to become aware that our field, our culture was changing, that there was more research showing the importance of religion and spirituality in clients' lives, and also that for many of them it was clearly beneficial, in addition to sometimes being a source of conflict that we should also deal with. But that there was no clear set of research-based competencies, and that we could not move forward without training psychologists, psychiatrists, and social workers without a set of clear competencies. So just as an example, in 1990, APA psychologists reported having discussed religious and spiritual issues during their own training, only 15% of the time. 20 some years later, well, no, what would that be? That would be 14 years later, up to a third of psychologists said they had received some training. And actually, the most recent surveys have shown that it's still only about 1/3. And why is that? Psychologists will not, or why do mental health professionals not talk to clients about their religion? They don't want to offend. It makes them uncomfortable to talk about religion because they don't know how to do that, or they don't believe in religion, or they have a negative view of religion. Patients will just bring it up if they need to. It's not my job. My job is therapy, et cetera, et cetera. So there's all these barriers to talking about religion. So together with several colleagues, we decided that we would work on developing a set of competencies. So phase one, we conducted a very thorough literature review, and we held an expert focus group. We invited about 24 psychologists, psychiatrists, social workers who were really very steeped in religion. People like me, Francis Liu I mentioned, and other colleagues who were very concerned about religion and spirituality. And we spent a weekend together at the Institute of Noetic Sciences, just brainstorming, looking at the literature and so on. And we came up with a list of 40 competencies. And then we conducted 2 surveys to hone that list of 40 competencies down to about 29. And then we conducted a survey of people who were not these were all psychologists, but ones who were not particularly interested in religion and spirituality. We wanted to get their views also on religion and spirituality, people for whom it was not their focus. And as a result of that, we came up with a list of 16 religious and spiritual competencies. And we published, this is our most recent article. It was just published this year in the American Psychologist's journal called American Psychologist, which is their flagship journal. It's the journal they send out to every psychologist. And we also worked on this book. You can see Cassandra Vitin and Shelley Scammell were 2 of the people who were involved in this work from the get-go. And let me give an example of some competencies. So if in the competency literature, they divide competencies up into attitudes and beliefs, knowledge, and skills. So one of the core attitudes for a clinician working with religious and spiritual issues is to cultivate empathy, respect, and appreciation for clients, regardless of their background, whether they're believers or atheists, but showing respect for their beliefs, whatever they are. Because there is a literature showing how some psychologists and psychiatrists, if they take a Freudian view, they may tell, and Albert Ellis is one of the people who definitely did do this and talked openly about labeling religious beliefs as neurotic and actually telling people, oh, if you believe that bullshit, then, this is a source of your neurosis. Okay. So showing respect and appreciation for their beliefs, that's one of the core attitudes. But then knowledge, can you as a clinician identify spiritual and religious experiences, practices, and beliefs that can be beneficial or that can be counterproductive? There are some religious beliefs that are actually negative, that can actually contribute to a client's depression or conflict. One example is believing that their illness, whether it's a mental illness or a physical illness, is a punishment. So there are people who think that if they get cancer, that's a punishment from God. It's actually surprisingly common. It's about a quarter of all people who have a life-threatening illness have the belief that this is a punishment. And some people who are depressed also think that God is punishing them. So those are very negative beliefs, and we as clinicians should go in there and talk to clients about how harmful those beliefs can be and maybe present them with alternatives. and maybe get their clergy to also work with them about the way in which illness is not a punishment from God. God may have other ideas in mind. And then there's this whole broad category of skills that we identified in our research. And one example is the skill of being able to assess spiritual and religious background, heritage, experience, practices, attitudes, and beliefs as a standard part of understanding a client's history. So these are 3 examples of the 16 religious and spiritual competencies. And much of my work over the past 30 years has been to develop a form of spiritual assessment, a spiritual assessment inventory that assesses clients' strengths, their participation in organized forms of religion and spirituality. And here, it doesn't just include participation in a church. If somebody, like my wife, for example, has been practicing yoga together with a group of women for 30 years, and often after their Friday class, many of them go out together and have lunch. And for them, it's a real source of support. They've gone through, loss or death of a child, divorces, and all kinds of things together based on, sharing that practice. I personally practice a martial art called Aikido, and I've been doing that also for about 30 years and practice that twice a week with the same group of people. And we often go out to dinner together after our Thursday evening class. And that has been a source of social support for me, both in celebrating positive things and going through some challenging periods in my life as well. Okay, so it's important to have a tool to guide us in that kind of assessment. So I have a course up on my website, and my website is spiritualcompetencyacademy.com. And the course is actually available for free. It is available for continuing education credit, and there is a fee for the CE credit, but you can go to Spiritual Competency Academy and take this entire course in an evidence-based, ethically sensitive, and strength-based approach to spiritual assessment, and that course is free to take. Okay, so let me go ahead and stop my presentation. And at this point, I'm available for any kind of discussion or question. And so, Yvonne, would you be channeling it?
Thank you, David. That was really, really interesting. We've had a number of comments come up in the chat. They aren't really questions. So I'm going to read you some of these comments and ask you to respond to these comments, please. So the first comment is, the Dalai Lama said that most mental illness comes from a long-term lack of love and a lack of compassion. So do you have any comment, reflection on that statement?
Based on the research, he's right. I mean, we know that a lot of people, when they go through episodes of things like depression, are not getting the social support, the compassion. We often use the term in the research literature of social support, but we know that that's one of the problems that people who are experiencing depression, but also anxiety and We know that people with more severe forms of mental problems, like even schizophrenia, are often very socially isolated, and so on. And now, actually, the Dalai Lama helped found a center at Stanford called the CCARE Center, the Center for Compassion and Altruism Research and Education, that is also trying to disseminate practices of compassion in the culture. And I think that would, over time, have beneficial effects on people who are having mental problems as well. So he's absolutely right.
Mm-hmm, mm-hmm. All right. Thank you. We're having trouble with our speaker spotlight here. We have another comment that I would like to ask you about. This person, we don't have their name, it just says iPhone, says, with the popularity of psychedelics and deep meditation courses, we seem to be seeing more and more people experiencing psychospiritual crisis states following expanded states of consciousness. So do you agree with that? Any comment about that?
It's absolutely true. People are out there experimenting. And it is possible, for example, now to do yoga and learn mindfulness all on YouTube without a teacher. And sometimes people kind of take it to an extreme, like they'll engage in very intensive meditation practice without a teacher. And there is now starting to be a literature. Dartmouth actually has a center that looks at people who are having dark night of the soul experiences as a result of their mindfulness practice. And I mentioned earlier that we know that yoga can generate a kind of kundalini crisis. And unfortunately, as again, people are doing this without a teacher. So, for example, in the Zen tradition, there is something that is acknowledged. In fact, there's something called the stink of enlightenment, because in the Zen tradition, it's recognized that some people will have an enlightenment experience, and then they'll think they're very special because they've had this experience. And a Zen master might say, hey, yeah, you've had a very valid enlightenment experience. And you know what you need to do now? You need to spend the next 6 months shoveling the shit in our horse stable or working in the garden. You are really not so special. You've had an enlightenment experience that was valid, but get out of here, go do some work. It's literally called the stink of enlightenment. So yeah, there are people who are doing these practices on their own. Now, I'm glad people are doing it. I do think, the vast majority of people benefit from learning yoga and mindfulness and Qigong on YouTube. My wife and I do some yoga, following a yoga teacher who would not be available if one of us went into a Kundalini crisis. But on the other hand, we're not doing it, at that level. We're not doing hours and hours of, like a 30-day retreat, or something like that. So mindfulness is not dangerous when it's done in those kinds of doses, like MBSR training, which is typically a 20-minute meditation session. People rarely get into trouble with that. But people have gone to, like Esalen Jack Kornfield has a kind of case study he's written about of somebody who came to Spirit Rock Meditation Center and then decided not to go to sleep at night, stay up all night and meditate. And then in the morning concluded that he was enlightened
barged into the dining hall, started to, do a bunch of karate things, started to tell everybody, that he could see their auras and so on. And this happened at a meditation center. And Jack Kornfield recognized that this was a result of the meditation practice. And at some fine mindfulness centers, they would have just called 911 and told the EMT staff or whatever to take that person to the psychiatric hospital. But Jack Kornfield is also a psychologist. He has a PhD in psychology, and he arranged for two of his senior students to escort that person out, do that strategy I mentioned at Zen centers. They got him working in the garden. They got him jogging because he had so much energy. They got him to take some cold baths. As I recall, they even fed him a special diet of more grounding foods. I think they even fed him some meat, which they don't serve at Spirit Rock. Anyway, they had somebody with him. They, were able to handle it to the point where he could actually start meditating again, without ever needing to be hospitalized or put on medication or anything like that. So, yeah, is some risk in these practices, especially when they're done without a teacher. So let me leave it at that. Yeah.
Okay, thank you. We have another question, David, from Christina. She says, I have a question about the DSM category. It would seem to me that conversion to a new religion or issues with a pastor describe a very different category of experience from spiritually transformative personal experiences like what you had and other mystical awakenings.
Well, that was one of the reasons that Francis, who I just saw his name here, so I know he's also listening, but one of the things that we did have to go to the mat with the DSM task force about was including the term spiritual, because they came back to us and said, well, why don't we just call it religious problem? Why do we need the term spiritual in there? And Francis and I had to prepare yet another kind of literature review arguing that there are many kinds of personally, spiritually transformative experiences that are not connected to any form of organized religion. I mentioned near-death experiences, mystical experiences, sometimes happen outside the context of any religious tradition and so on. And so we had to go back and forth with the DSM task force to include that term spiritual, to acknowledge that, yeah, there are different types of experiences, some of which are really much more connected to a religious tradition and some of which are much more individually spiritually transformative.
Mm-hmm, mm-hmm. Awesome. Thank you, David. This question comes from Brian, and Brian says, David, did you think after the 2-month period of your awakening experience that you perhaps had been mentally ill? If so, how long did you think that? Thank you for your work, Brian.
Again, I was really, really lucky. If I had been thrown into a psychiatric hospital and, everyone treated me like you've really, had this psychotic experience, I'm sure over time I would have started to question my mental health in that setting, especially if I'd been given, back in the 70s, I guess it would have been Thorazine, and all of a sudden, became very stiff and zombie-like in my walk. And I definitely experienced some self-doubt and some depression, but I did not think I had a major mental illness. So again, I that's what led me to then later, kind of support this idea that people can have these kinds of experiences and not have a mental illness. And I benefited from being able to go through that whole experience without anybody telling me I was psychotic or crazy. And I never really entertained that idea.
Interesting. Whoops. Again, we're having problems with the spotlight. We have another question from Anne. Thank you for that last answer, David. Anne would like to know, how do you feel about energy medicine as a core to healing on every level?
Well, there's definitely within energy medicine some techniques that I'm sure can be helpful and help people who are kind of in that state of mind I was in for 2 months get more grounded. EMDR and things like that, I think can help people get back into their bodies and get more grounded. So I'm sure there's some energy modalities that would be very, very helpful. I'm very pleased that I've seen many veterans hospitals start to incorporate things that when I worked at the VA were really radical, like mindfulness. I started to teach a meditation group at the San Francisco VA Medical Center, and it led to the Inspector General of the VA conducting an investigation because I was accused of teaching religion at the VA. There was actually a devout fundamentalist Christian who saw I was teaching a meditation group voluntarily. Anybody who wanted to come to learn to meditate could come to my class at the VA. And he filed a complaint that I was teaching religion. And the Inspector General started an investigation of me. My job was on the line. Here I was, a new psychologist. I had a 1-year-old, my wife was pregnant. All of a sudden, my job was on the line for teaching meditation. Fortunately, Jon Kabat-Zinn had already published a couple of research articles on the mental and physical benefits of mindfulness. And I was able to send them to the Inspector General in Washington, D.C., and he ended the investigation. But why did I go on that? Oh, just to say that the VAs in the United States now are incorporating mindfulness and EMDR and some of these grounding techniques that I think people really can benefit from who are in some of these, who are going through some of these kinds of mental health crises.
Awesome. Thank you. This will be our next question. There are lots of questions and comments, but this will have to be our last one. Suzanne would like to ask you, have you ever known insurance to pay for that V code diagnosis of spiritual religious problems? Wish I could go to self-pay as a therapist, but I know geographically placed people generally want to use insurance. And then she says, thank you so much for your time. I'm going to take your class. So, well, will insurance pay?
For the most part, if that's the only diagnosis, no. However, I did have a couple of people who, one worked for the telephone company, I think it was still called Bell back in those days, who the policy was they could go to therapy for 10 visits a year for any reason. They could go for marital counseling. They could go for a religious or spiritual problem. It didn't anything. And so I was able to use the diagnosis with those people. But otherwise, no. I did sometimes use it as an additional diagnosis, but the insurance would only cover it if there was also a diagnosis like major depression or something. But it was still a useful category. I've certainly gotten a number of emails and so on from people who have said that they used it as an additional diagnosis to kind of reflect that part of the work they were doing with the client was in the area of religion, their religious or spiritual conflicts.
Thank you. Thank you, David. I just wanted to share that my clinical experience in Canada, while I was still practicing, was the same, that it would not be used alone. I had to use it together with another diagnosis. But anyway, that was in Canada, here in the US. So thank you, Dr. David Lukoff. That was phenomenal. You have been really groundbreaking. So thank you once again for all you have done and for speaking with us today at the conference. So thank you.
And thank you for creating a forum for this kind of sharing and discussion.
Thank you. Thank you.